Hello everyone. In this video, I'm going to talk about escitalopram. Escitalopram is one of the medications that is classified as a selective serotonin reuptake inhibitor. It is well known by its brand name, Lexapro. This medication elevates the mood in the people by increasing the levels of serotonin in the brain. It can be used for treatment of depression as well as insomnia. It can also be used for treating various types of anxiety disorders. Escitalopram is the S-enantiomer of citalopram. Before using this medication, you should know important facts about this medication, like how it affects your sodium levels in your body. What is its effect on the bleeding, vision, and your alertness? All such facts will be discussed in this video. How does it work? Escitalopram is a selective serotonin reuptake inhibitor. It increases the levels of serotonin in your brain, which elevates your mood. This medication is highly selective for inhibiting the reuptake of serotonin with little effect on norepinephrine and dopamine. Because of high selectivity, it can bind to one of the transporters that is specific to the serotonin. On the presynaptic neurons, a transporter called SERT, serotonin transporter, is responsible for the uptake of released serotonin into the neurons. Escitalopram binds to an allosteric site on this transporter, which inhibits the reuptake of serotonin. It has strong binding, as this medication binds to an allosteric site on this transporter, which even reduces its dissociation from this site. In this way, escitalopram has a strong action on the inhibition of serotonin reuptake. This results in the elevated levels of serotonin in the brain, which improves the mood and reduces the symptoms of anxiety. However, this medication may take around 4 to 6 weeks to show its full effects on relieving symptoms. How to take this medication? Escitalopram is available as tablets as well as an oral solution. In the form of tablets, it is available at different strengths such as 5 mg, 10 mg, and 20 mg. As an oral solution, it is available as 5 mg per ml for the treatment of major depressive disorder. For treating depression, it can be initially started at 10 mg per day. It should be administered once daily, either in the morning or evening. It can be taken with or without food. The peak plasma concentration can be observed after 5 hours of administration with a single dose. The dose may be increased after 1 week to 20 mg per day. Escitalopram can also be used for the anxiety disorders. For that purpose, again, it can be started at 10 mg initially. The dose may be gradually increased to 20 mg per day based on the response. For the treatment of insomnia, it can be started at 5 to 20 mg. Effect on your eye. Escitalopram can increase your pupil dilation. This may increase your intraocular pressure. Particularly, this is more important in people with angle closure glaucoma. It is one of the anatomical disorders with narrow angles that reduce the excretion of drainage of aqueous humor, which results in the increase in intraocular pressure. In such people, escitalopram can increase the risk of glaucoma. Effect on alertness. At a dose of 10 mg per day, you may not have impairment of your alertness and psychomotor performance. However, at higher doses, you may have slight disturbances in your alertness. It is common with many medications that act on your brain, and such effects may not be observed in all people. However, be careful while driving vehicles or working with hazardous machinery when you are at higher doses. Risk of bleeding. When you start the therapy, escitalopram can increase the risk of bleeding. This is common with many of the drugs that are going to inhibit the serotonin reuptake. It may cause nasal bleeding. Bleeding may also be observed due to rupture of blood vessels under the skin, leading to a blue or purple appearance of the skin. It may also cause a condition called hematoma, a collection of blood pooled outside of the blood vessel due to damage to the blood vessel. These effects are well controlled in many people. However, if you are using oral anticoagulants like warfarin or antiplatelets like aspirin, the risk may be more pronounced. Hyponatremia. Escitalopram may reduce the serum sodium levels to less than 110 millimoles per liter. This condition is called hyponatremia. It is due to improper secretion of antidiuretic hormone. Elderly patients may have more risk of hyponatremia. If you are using diuretics, the risk may be more enhanced. Symptoms include headache, difficulty concentrating, memory impairment, confusion, weakness, and unsteadiness. Serotonin Syndrome. Escitalopram can produce a condition called Serotonin Syndrome. This is due to excessive elevation in the levels of serotonin in your brain. It may cause a few symptoms like agitation, hallucinations, and a few mental changes. Tachycardia, elevated blood pressure, dizziness, excessive sweating, and flushing can be observed. A raise in the body temperature, tremor, and muscle rigidity are also observed. This syndrome is more pronounced if you are using other medications that increase serotonin levels. If you observe these symptoms, you may need to stop this medication. Other effects. Escitalopram can produce sexual dysfunction in both males and females. It may produce a delay in the ejaculation, decrease sexual stimulation, and cause erectile dysfunction in the males. This medication can also increase the risk of seizures in people with any previous history. Escitalopram can produce a condition called either mania or hypomania. Mania is a high condition of hyperexcitability, whereas hypomania is an intermediate state between mania and depression. Drug interactions. Pymazide is a neuroleptic agent. When it is taken simultaneously with escitalopram, it increases QT intervals in the ECG, leading to cardiac arrhythmias. Therefore, the use of pymazide is contraindicated with escitalopram. Discontinuation syndrome. When you discontinue escitalopram suddenly, you may have few symptoms like irritability, agitation, and dizziness. Abnormal sensations, anxiety, confusion, lethargy, and insomnia may be observed. Most of these symptoms are self-limiting and not serious. However, if you observe very serious symptoms on discontinuation, you can resume your previously prescribed dose. Then it can be reduced gradually to avoid discontinuation syndrome. Side effects. It mainly produces a few common side effects like nausea, dry mouth, constipation, tiredness, drowsiness, dizziness, and increased sweating. You may have loss of libido and failure of ejaculation. Few people may have indigestion and rhinitis. That's all, guys. These are the essential facts that you should know about escitalopram. Thanks for watching this video. If you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.